Connie Berryhill, and I am the Diabetes Educator and Coordinator at Muskogee Creek Nation Coweta Indian Health Facility. This past year and a half, the world has seen many changes concerning our health and our healthcare systems. I have noticed some of us, out of concern for our health and perhaps for others close to us, have opted not to go in for our scheduled healthcare visits. Telehealth and virtual visits increased due to limited clinic appointments. Some liked the telehealth visits, while some did not. No matter what the case may be or what the future in the healthcare holds, I think it's very important that we still maintain care of our health. I want to encourage everyone to do everything possible that you can to be healthy. I believe we can help ourselves by being good health advocates for ourselves. When you become an advocate in your healthcare, you become empowered. Healthcare advocates take control of their healthcare experiences. By doing this, you and your doctors are able to make decisions as a team. Healthcare advocates are able to speak up with questions, needs, concerns, and preferences. Personal empowerment can provide a sense of being in control over your own life. It can improve quality of life and turn helplessness into hopefulness. Self-advocacy means that you arm yourself with the tools and skills necessary to feel comfortable about asserting yourself and communicating clearly about your care needs. So let's talk about how to be an advocate. You may want to keep a binder or a folder to help you keep all your health records in one place. As a healthcare advocate, you should maintain your own records. Know the dates and times of your appointments and follow-up appointments. This includes a dilated eye exam, diabetic dental exam, foot exam, immunizations, as well as your labs. Make notes about your medications, physical activity, any illnesses, low blood glucose, stress, or other factors that are affecting your health. When you meet with your providers, bring your notebook. Share these numbers and facts with them. Don't be afraid to ask questions. In fact, write down your questions ahead of time so you don't forget to ask them. Living with a chronic condition can be a challenge. Everyday life can distract you from diabetes management. But managing your diabetes is important. You can work with your healthcare providers who can support and advise you in creating a management plan that is best for you. Remember, you are the expert on you. Make sure your plan is one that works for you. So, let's start by knowing your ABCs. A is for A1C, B is for blood pressure, and C is for cholesterol. These numbers are important. Be sure to note your numbers from your lab results and know what your goals are. A1C. An important part of managing your diabetes is keeping track of your blood glucose numbers using the results of your A1C test and a blood glucose meter. Your A1C report tells you your average blood glucose for the past 3 months. Keeping your blood glucose in the recommended target range can prevent or delay the long-term health problems caused by diabetes. For someone who has diabetes, the target goal of an A1C is 7.0 or less. A glucometer enables you to test your blood glucose at home. Most diabetics should test their glucose at least once a day before eating. This is called a fasting glucose. Some people should test more often. If you do not know, ask your provider how often they recommend you test your glucose. ADA targets for blood glucose using a glucometer before meals are 80 to 130. 2 hours after the start of a meal, it should be less than 180. Most glucometers will log your 7-day, 14-day, and 30-day home glucose averages. You can ask anyone on the diabetes staff to help you find these numbers on your glucometer. Keeping track of your blood glucose readings helps you identify patterns. This is a good idea, especially if you are having high or low glucose issues, or are not meeting your goals. Use the log to note when you have been sick, stressed, very active, or what you've even eaten for dinner or at your meals. You can then talk about your glucose numbers in more detail with your provider. B is for blood pressure. Your blood pressure numbers tell you the force of blood inside your blood vessels. When your blood pressure is high, your heart has to work harder. High blood pressure damages blood vessels and worsens the damage caused by high blood sugar. Blood pressure should be measured at every routine clinical visit. A healthy blood pressure for a person with diabetes is less than 130/80, and a person without diabetes is less than 120/80. Hypertensive patients with diabetes should monitor their blood pressure at home. When you measure your blood pressure at home, you should be rested. You should be rested at least 5 to 10 minutes before monitoring. Be seated with both feet on the floor and your arms supported at heart level by a pillow or resting your arm on a table. Attach a blood pressure log to your refrigerator or your bathroom mirror or close to wherever you typically test your blood pressure. Bring this log with you to your health care visits. Walking is a great activity to lower your blood pressure. C is for cholesterol. High cholesterol may cause hardening of the arteries, which can raise your risk for a heart attack or stroke. A healthy cholesterol goal is less than 200. To improve your cholesterol, limit saturated fat, trans fat, and dietary cholesterol, and walk daily. LDL cholesterol is known as the bad or the lousy cholesterol. Goal is less than 100 or less than 70 if you have heart disease. High LDL causes buildup of fatty plaques on the blood vessel walls and can lead to slowing or blockage of blood flow and an increased risk for heart attack. A healthy HDL goal would be greater than 40 for men and more than 50 for women. You need more of the good cholesterol to help remove the bad cholesterol from the blood vessel walls. Getting regular exercise can help raise your HDL. A healthy level of triglycerides is less than 150. Triglycerides are fats that thicken your blood and slow blood flow. They are related to overeating starches, especially sweets. Eat a healthy diet with plenty of fresh fruits and vegetables to lower your triglycerides. Some other lab tests you want to be aware of concern your kidneys. Your kidneys have millions of filters that remove waste from your blood. These filters keep protein in your blood. High blood glucose can damage these filters. When kidney disease starts, the filters in the kidneys do not work well. This causes protein to pass into the urine. You cannot see or feel this, but your healthcare provider can test your urine for it. On the screen, you can see lab tests concerning your kidneys and healthy goals. Knowing when to make an appointment to see your healthcare provider is also important. Be sure to call your healthcare provider right away if your blood glucose stays over 240 or under 70, even though you have taken your medication as directed. When you are feeling ill or you can't keep liquids down for more than 4 hours or have vomiting or diarrhea for more than 6 hours. Call your provider if you have not eaten normally for more than 24 hours or have a fever of 100.4 Fahrenheit or higher. If you have trouble breathing or shortness of breath. If you can't stay awake or think clearly, or if your chest hurts. If you have a wound or a cut that is slow to heal, feels warm, oozes fluid, or smells bad, or just any time you aren't certain what to do to take care of yourself, it is always a good choice to call and speak with your provider. I encourage you to take some time to think about your health goals. Ask yourself how you define a good quality of life or what matters most to you when it comes to your health. Successful health advocates feel more confident about the choices they make with their providers. They're often healthier and may even live longer than people who let others make all of their health care choices. You can reach a diabetes team member at any one of the clinics listed on your screen. Stay healthy, Mado.